Everyone present?
Kino present.
Tina present.
Tootie present. And I'm here and I'm so excited to share my nuggets every week.
All right. So we have Tootie, someone new in this podcast. So let's start the Nugget Rounds, guys.
Okay, so for our new rotators, Nugget Rounds is our weekly chat where we take turns sharing some little nuggets of knowledge we picked up. If you have a nugget to share, feel free to post it down below.
So guys, anong nuggets nyo this week?
Hello. For my share of nuggets, it will be on tetralogy of Fallot. We got a couple of cases of this in the hospital. It's very common for residents to have a template of questions for us students. So that's what I'm going to share with you guys. So hopefully when you rotate sa pedia, may sagot na kayo. Okay, so first, what are the components of TOF? So this is basic naman. So we have the mnemonic PROV, P-R-O-V, so your pulmonary stenosis, your right ventricular hypertrophy, the overriding of the aorta, and your ventricular septal defect. So something easy to remember naman, PROV. Okay, so the next question that they usually ask is, what is the most important lesion among the four? So does anyone want to venture an answer?
Like, important how? Parang pinaka nag-drive ng pathology.
Yes.
If I remember right, it's the stenosis, diba?
Yeah, it's the pulmonary stenosis.
Yeah.
So it's the lesion that specifically limits the blood flow from the right ventricle to the lungs. So less blood is oxygenated and ergo TOF as a cyanotic heart disease. So this clinically presents with a loud systolic ejection murmur at the mid and upper left sternal border with radiation to the back. So next, usually they ask, oh, so what are TET spells? I was like, TET spells? And I remember it happens when patients cry. But then I was like, what's the formal definition again? So I had to look it up. So TET spells are sudden, potentially lethal episodes of severe cyanosis, or even called hypercyanotic spells or hypoxic spells. So these occur during activities that suddenly lower the systemic vascular resistance, such as in crying or even feeding or defecation. Then usually the residents will just ask you next. So what is the hallmark of a TET spell? Okay, do you guys want to try?
Wait, so hallmark, basically, what do you mean by hallmark? So, like, ano yung physical exam that you find?
Yeah. So what do you look for to call it a TET spell?
Pero diba this is like when you have obstruction to pulmonary blood flow? Tama ba to?
Yeah.
So, physical exam finding. May clue ba? May clue.
I was like, Actually, tama, you were on the right track naman. So there's obstruction, diba, to pulmonary blood flow. So I always thought the answer was cyanosis. And that was like the
cyanosis.
first thing that everyone answers, diba? Parang cyanosis, that's what the TET spell is. Like, oh, your lips po, the lips turn blue, ma'am. Or usually, apparently I was wrong. Apparently you call it a TET spell if there's a disappearance or a decrease in the intensity of the systolic murmur. So it will occur because the blood flow across the right ventricular outflow tract diminishes during the spell. So these spells are associated with the reduction of an already compromised pulmonary blood flow, which, when it's prolonged, it results in severe systemic hypoxia and metabolic acidosis. Yeah, super cool. I was like, oh, it's the murmur that you listen for. Okay, not the cyanosis alone. And then lastly, they ask, what do you do for patients who have TET spells? And this is probably the most important nugget of them all from what I've mentioned. And there's actually a mnemonic that's very important. And they always ask it, and I didn't really think of it before. But the mnemonic is POSH. So POSH. So first, positioning. So you put the knees to the chest. So, yeah, so this increases the preload to the heart, more circulating volume in the heart. Then O is O2 support. So of course, to oxygenate the blood. Then S, sedative. So we typically give ketamine, so 1 milligram per kilogram per dose IV. And this will decrease the demand of the body. So like I mentioned earlier, it happens when the patient is crying or feeding or mostly crying. So when you sedate them, it's decreased demand. And then 8, hydrate. So if you hydrate, you give them IV fluids, there's an increase in the circulating volume. So there, POSH. Position, O2 support, sedative, and hydrate. And those are my nuggets for TOF.
Wow.
Wow. What a posh nugget.
Tootie, how many, just a like curious question. Would you have an idea of like how common this is in pediatric wards in the Philippines? Like usually, do you think do you think it's a very common thing to see?
Out of the cyanotic heart disease, cough is actually the most common. When we do get patients who present with cyanosis, cough is usually the first thing that we look for. Also, I wanted to share this, but I hesitated. Tinanong ako ng resident. So, what's pentalogy of palo? And I was like,
Oh, may ganun pala.
a pentalogy? Apparently there is. So, the additional component is an ASD.
Oh.
Lala. Apparently, yeah, TOF has like a lot of variants.
That was super interesting, honestly.
Yeah, that's actually it's really interesting. It's really interesting. So thanks for that sharing, Tuti. And speaking of common things, no, today's nugget, I'll be sharing about breast cancer, which is one of the leading sources of like breast cancer among our population, and it's also International Breast Cancer Awareness Month. So it's very fitting that we discuss about breast cancer. So
Very pink.
yes, go pink. So I'll be talking about nuggets from breast cancer, and we'll first start with the breast assessment. So it's one thing I learned recently on how to assess the breast, and there is, syempre, when we try to examine the breast, no, we have to be systematic about it. We make sure that we examine all of the portions, all of the areas of the breast, and we check for a couple of things. No? In particular, we have LMNOP, which stands for lumps, mammary changes, nipple changes, orange peel, yung peel orange, and check for predisposing factors like if the patient has family members or relatives who had breast cancer before, or meron a known genetic factor like the BRCA gene. Uh, just to have a quick reminder, do you guys remember in which quadrant breast cancer is commonly found? Like, you can divide the breast into four quadrants, right? There's the uh, upper outer, upper inner, lower outer, lower inner. Do you guys remember? It's like a common question that gets asked. And there's only four choices. Do you guys remember?
Almost sure. Upper outer.
Yes, you're correct, Tina. It's upper outer. Tama-tama si kanina. So it's upper outer. Like around, I think, majority of the cases are in the upper outer area. And it's important, of course, for females to perform the self-breast exam. And they should undergo screening for breast cancer. And there's also an important thing about diagnosing breast cancer, which is something I also just read about recently, which is the triad of error with breast cancer, which is basically like you least suspect breast cancer to happen in these patients, but you still have to be wary about them. In particular, these are uh, young patients, so patients who are less than 45 years old, those with negative mammograms, and mass found by the patient. So yung mga yon, like, usually you'd rule out that they have breast cancer, but then you have to ensure that that they're really negative for breast cancer. And I think I'm going to share just some pearls that I learned about the surgery for breast cancer. And yung pearls na to would be regarding MRM, which is yung modified radical mastectomy, which you do for breast cancer. And the one I'm going to be asking about actually is, what are the two most common nerves that are damaged in MRM? Which is, I think I've assisted in a couple of MRM, and this always gets asked. What are the two common nerves? Would you know, Tuti? At least one.
The long thoracic.
Yes, long thoracic is one. How about you, Tina? Do you know the other one?
Yung thoracic lang yung tanda ko.
Long thoracic. There's also another one.
Thoracodorsal.
Yeah, thoracodorsal. Yeah, so those two. And obviously, they also ask like, what? Yun na lang. I'm gonna leave it with that. What muscles are innervated by the long thoracic nerve and the thoracodorsal? Because that's the one they usually ask.
For long thoracic, it's your serratus anterior. And then for
Yeah.
thoracodorsal, it's your latissimus dorsi.
Yeah. Yes, that's correct. So of course, Tootie would really know this. But yeah, thoracodorsal, but dorsal, so it's easy to remember. It's latissimus dorsi. And for the long thoracic nerve, since it's close to the chest wall, near the chest wall, it's easy to transect that nerve. And if you transect that nerve, which supplies the serratus anterior, you can have what's called the winging of the scapula. So that's my nuggets for the week.
Wow. That reminds me of all the MRMs I've seen then. It's true. Like, they always ask what you have to preserve and look out for. Especially since, diba, we were talking last week about anatomy.
Diba?
So, kailangan ma-identify talaga yung long thoracic and thoracodorsal during the surgery. Very true, very true.
Yeah. That's why they always ask that question in the OR.
So for me naman, for this week, so OB pa rin kami, OB-GYN. So it's our third week in OB-GYN, so telemed. So usually, kasi no last day namin ng duty sa telemed, wala akong patient, walang nag sa aking patient. Then the second, wala din. So more on, yung i-share ko more on what I learned sa pre-op conferences. So anyway, so I'll be sharing ectopic pregnancy. So, one of the cases kasi presented nung pre-conference was ectopic pregnancy. Then, yun, as we know, ectopic pregnancy occurs when the blastocyst implants in other sites other than the endometrial lining ng uterine cavity. So, ano ba yung mga common sites ng ectopic pregnancy? Based on sa mga naalala, pinaka most common
Ampulla.
sa ampulla.
Fallopian tube.
Oo, sa fallopian tube to, diba? Like, we're talking about the fallopian tube.
Pero, next sa tubal, diba, pag tubal, fallopian tube yun. So, next dun is yung ampullary nga,
Just making
na
sure.
one of the most common. So, ampullary na is a good. Then, yun nga, so for the theoretics, diba, yung risk factor, ano ba yung mga risk factors natin for ectopic pregnancy? First, di ba, malaking risk factor for ectopic pregnancy was, syempre, pag meron kang previous ectopic pregnancy, so, understandable, yun yung one of the most common risk factor. So, second is, if you have tubal sterilization, then if you have tubal corrective surgery, so yun yung ibang mga factors. So, another is yung IUD, documented tubal pathology, infertility, previous genital infection, and multiple partners then in previous, if meron ka man previous pelvic or abdominal surgery or even smoking. So, what are the other signs and symptoms nung ating ectopic pregnancy? So, yung classic triad natin, di ba, nung ectopic pregnancy is abdominal pain, amenorrhea, and bleeding. So, sa pain, so pelvic and abdominal pain is very common sa ectopic pregnancy. Minsan nga, di ba, yung tinatawag na cervical motion tenderness, di ba, pag may ganun, pag positive siya sa patient, di ba, isipin lagi natin agad is ectopic pregnancy. So, yun lang. So, aside from the classic triad nung ectopic pregnancy, pwede rin magkaroon ng mga uterine changes, blood pressure and hypotension and tachycardia, and high temperatures. And minsan nga, meron tayong napapalpate na pelvic mass. So, yun lang naman yung gusto ko lang muna yung i-share kasi I don't wanna talk about the whole ectopic pregnancy thing.
Yeah.
So, what about you, Kino? What's your nugget for this week?
Wow, you guys have such good nuggets this week. But you know what brings them all together? Surgery. And what do you have when there's surgery? Anesthesia.
Okay.
So, my nugget this week, Anus Nuggets. When it comes to Anus Nuggets, the first one I really found interesting this week was neuromuscular signs. So usually, diba, when you talk to a patient, unreliable pala when you're just checking for eye opening, tongue protrusion, arm lift, normal tidal volume, normal vital capacity. and a max inspiratory pressure of less than 40 to 50. The reliable signs actually are 5 seconds of head lift, leg lift, hand grip, tongue depressor test, and a max inspiratory pressure of greater than 40 to 50. So that's a really good thing, especially when you're going through monitoring in the post-op care unit or PACU, I don't know how people call it. Another common complication is post-operative nausea and vomiting. So when it comes to that, it's really important to look out for other risk factors in patients. So this would be young female with a history of motion sickness, especially if it's an ear surgery or there's post-operative pain. So yun yung mga risk factors for PONV. While you're monitoring them, it's good to remember that suitable targets are BP limits within 20% of baseline, respiratory rate of between 10 to 30, and a heart rate that's about constant for at least 30 minutes. So this is how you know that the general condition's okay. But more than that, it's also important. Another nugget I had this week is the naloxone dosing. So in our previous lectures, we always talk about opiate overdoses. And they say, okay, what's the antidote for it? It's naloxone. You'd think, ano ba talaga yung dosing nito? How do you give it? How often? So it turns out, what you do for naloxone is, of course, first make sure you're ventilating the patient with bag mask ventilation. But when you're giving the naloxone, in 2 to 3 minute intervals until there's an increase in respiratory rate, there's actually a stepwise process to giving. So it's initially 0.04 milligrams, and 0.5, and 2, 4, 10, 15. When I was looking at it kanina, it's like, oh, interesting numbers to pick from kasi 0.04 to 0.5. Tapos from 0.5 to 2, 2 to 4, 4 to 10, then 10 to 15. And then to also remember that in these patients kasi, there might be bradycardia present because the hypoxia can lead to bradycardia. So when you're monitoring them, it's always to keep those in mind. So yun, puro honest nuggets and monitoring the patients ang nuggets ko for this week.
Wow. Thanks, Kino. I learned a lot from your nuggets. And, you know, tama nga yung point mo, no, that it's important that we also learn yung mga honest considerations, especially when most of us are rotating in
Surgical rotations.
surgical rotations, cutting field.
Yeah, it's always good. Pero like what they say, you have to prioritize what comes first. Like, what's the point of doing the operation when it turns out that like the desat na pala yung patient? So you have to remember, like, it might be a hassle, pero if they lose the airway, you'd stop the operation first and find it para at least stable yung patient during it.
So, guys, any last bites?
I wanted to share something. When JonaChan was sharing about MRM, that a consultant asked me about MRM. So they asked me what's the most common thing that patients complain post-operatively. The first thing I thought about was the absence of a breast mask. That's very obvious, but honestly, the answer is upper medial arm numbness. So this is actually caused by transection of the intercostobrachial nerve. It's a very small nerve that I didn't really remember when I was studying anatomy, but apparently it's something that that's also commonly transected in this type of surgery. So that's why patients complain of numbness.
Yeah, I think this was also asked to me by one of the ORs that I attended to, but then it was phrased to me like a homework. Like, I'll ask though, what happens if the intercostobrachialis nerve, tama ba?
Intercostobrachial nerve.
Yeah, intercostobrachial nerve is transected. The second was phrased to me as an assignment. And as actually I never got around to do it. But so yeah, no, thanks for that, Tootie.
An extra piece of nugget for tonight.
Yay! Actually, magandang discussion tonight, especially we're back to our main four. And I think continuing on from Jonathan's, remember to Anna's for surgical. Also remember na it's important to treat not just what we're monitoring the vitals, we're also treating the patient. So Like when you're talking about breast, or you're talking about ectopic pregnancies, or talking about pedia, we always think, think about the patient. It's not just numbers, but how does it relate to them? Okay, if you look at a lot of our nuggets this week, it's about really getting to know our patients.
Yes, true. That's true. Ako din, parang in relation to what Jonathan discussed na breast cancer. Nung this week sa telemed, pag yung mga breast cancer patients, 'di ba we give them tamoxifen. So 'di ba yung tamoxifen, 'di ba, napopromote niya yung proliferation ng endometrial lining.
Yeah.
Yun yung effect 'di ba ng tamoxifen usually. So kaya pina-refer sa amin is to check na lang din the endometrial lining din ng patient as effect nung management sa kanya. So, yun lang. In relation dun sa breast cancer na topic ni Jonathan, ang galing may na-share ako in relation to his nuggets for this week din ulit. Just like last week, parang interrelated din. Wala lang.
Yeah. I mean, that really harps in on our theme of Nugget Rounds, that medicine is really interrelated, and all of the rotations that we're going through is, just artificial lang naman yung boundaries niya. It's still about the entire human person at the end of the day.
Oo, totoo yan. So guys, any last bites for this episode?
I think we're good. No? Everyone, we have had a great discussion this week.
Yeah, thank you Tootie for your tons of mnemonics, mga text spells, posh, and TOF, and also the pentalogy of follow. Grabe, ang daming mga variants ng follow natin, no? And then for Jonathan, syempre yung breast cancer, na daming na-share with regards to that. And then not only siya, maraming na-share tayo din. Ang dami natin na-relate dun sa shinare ni Jonathan. Then, yung sa akin naman is yung sa ectopic pregnancy. And then kay Kino, of course, yung sa yung mga yung mga neuromuscular signs, and then naloxone. So, at least ako as a next anes rotator after na OB-GYN. Thank you, Kino, sa inyong mga pa-learnings this week.
So yeah, I think we can end the rounds for this week. And with that, thank you to everyone listening. And Tootie, bring us out of here.
Stay hungry for nuggets and see you next week.
Yay!
Yay!
Bye everyone. See you next week.
Thank you, Tootie.
Woohoo!
Life saver for this week.